welcome to another edition of Hendrik's High Yield Pediatric Topics. Today, we are quickly going to discuss the neurocutaneous disorders. Remember that the ectoderm in the fetus is going to give rise to the skin, the teeth, the nails, the hair, as well as the brain. So if you find abnormalities on the skin, you may think that if something happened in the fetus, that may have affected their brain development as well. The first neurocutaneous disorder that we're going to talk about is tuberous sclerosis. Tuberous sclerosis is inherited in an autosomal dominant pattern. And we have some classic, I have another very low-tech image for you, but there are some classic appearances that we see for tuberous sclerosis. You can get hamartomas on different organs, the brain, the eye, the skin, the kidneys, as well as the heart. And when we're talking about the cutaneous findings, this is a copy of an image from one of my slides. We have the classic ash leaf spots. The ash leaf spots are those hypopigmented patches with very clear borders, very clear demarcations. You can also get, I don't know if this is coming out too well, but something called the shagreen patch. Shagreen patch has that orange peel appearance to it, right? This is more of a plaque, so it's raised and has an orange peel appearance. You can get ungual fibromas, fibromas right around the nail bed, as well as retinal hamartomas. That's what this image is here. So that's tuberous sclerosis. Tuberous sclerosis, ash leaf spots, and shagreen patches are the two big ones to remember. Moving on to neurofibromatosis type 1. It is also inherited in an autosomal dominant pattern, and so this is another one you really want to get a good family history of. The tumors grow in the nervous system. The most common tumors that they have are the neurofibromas. You can see some learning disability, some scoliosis, some seizures, macrocephaly, some optic gliomas. Malignancy is the most common cause of death in patients that have neurofibromatosis type 1. In order to diagnose neurofibromatosis type 1, you need to have greater than or equal to 2 of the following criteria. Greater than or equal to 6 cafe au lait spots. Remember, those cafe au lait spots are those patches, so they are flat. They look hyperpigmented. They look like cafe au lait stands for coffee with milk, so they'll look like a light brown color. Greater than or equal to 2 neurofibromas. Freckling in the axilla. Greater than or equal to 2 leash nodules, and we'll talk about those in a moment. An optic nerve glioma, scoliosis, or a first-degree relative with neurofibromatosis type 1. So all you need is 2 or more of those classifications. The 6 cafe au lait spots, the 2 neurofibromas, the freckling in the axilla, the 2 or more leash nodules, the optic nerve glioma, the scoliosis, or the parent or sibling with neurofibromatosis type 1. This is the image of that. So here, this is demonstrating the freckling in the axilla. You can see there are also some beautiful cafe au lait spots there. So those flattened lesions. And then over here, these are just the neurofibromas. So those nodules, those firm nodules that may appear on the cutaneous surface. And this down here are those leash nodules. So neurofibromatosis, we're thinking cafe au lait spots. That's in contrast to the ash leaf spots. Both of them are patches, so they're both flat, but cafe au lait are hyperpigmented, and the ash leaf spots are hypopigmented. So neurofibromatosis type 1, freckling in the axilla, the cafe au lait spots, the neurofibromas, the leash nodules. Moving on to neurofibromatosis type 2, the other name for this is schwannomatosis, which I think is a much better name because it clearly distinguishes that they are 2 very separate illnesses. For neurofibromatosis type 2, we don't expect to see the cafe au lait spots, the neurofibromas, or the leash nodules. It is also inherited as an autosomal dominant trait. It also involves multiple tumors. These tend to be intracranial or spinal tumors. And almost all of the affected individuals for neurofibromatosis type 2 have bilateral vestibular schwannomas by age 30 years. Cataracts can be common, and then once again, for neurofibromatosis type 2, there are no leash nodules, no cafe au lait spots, and no axillary freckling. In order to be diagnosed with neurofibromatosis type 2, you can have bilateral vestibular schwannomas to get the diagnosis, a family history of neurofibromatosis type 2, and then any two of the following: a glioma, a meningioma, a schwannoma. And then that's going to move us on to Sturge-Weber. Sturge-Weber is the final neurocutaneous disorder that we're going to talk about. It's sporadic. It does not tend to be genetic. You get angiomas of the leptomeninges. And then the big thing with Sturge-Weber syndrome is that ipsilateral port wine nevus. So it's an ipsilateral port wine nevus. It tends to be in the distribution covering part of the forehead and over one eye. This port wine nevus looks like a port wine stain. So instead of the cafe au lait, instead of looking light brown like coffee and milk, it looks like red wine. It's more reddish, purplish, and it is completely flat as well, so it is also a patch. They tend to have seizures due to ischemic injury to the brain underlying the meningeal angiomas. And they can have progressive ischemia. They also tend to get calcifications on the gyri of the brain underlying an angioma, and that can give this tram track sign on imaging. So here is a picture of a baby with that classic port wine stain in that trigeminal distribution, right? So over the part of the forehead and covering part of the eye. You see a baby that has this, and you definitely want to get some imaging studies. You want to do some more workup for Sturge-Weber syndrome. We'd be worried about seizures in these kids. Looking at the imaging, and I don't know how clear that is, but this is the tram track, those calcifications on the gyri. They're calcifications that are underlying those meningeal angiomas. And here we can see some more in that image as well. And that's the end. Thanks so much.